And now, a segment from the Best of the Night Side with Barb DiGiulio podcast. Listen and download the latest podcast at Newstalk1010.com.
Welcome back to the show. We have a special guest in this hour. Dr. Stephen Mulholland is back, cosmetic plastic surgeon at SpaMedica here in Toronto, one of Canada's leading cosmetic plastic surgeons. Welcome back.
Thank you for having me back, Barb.
Oh, it's so nice of you to agree to join us once again. You know, last time the phones rang off the hook because so many people, I think this is a topic that everybody has thought about at one time or another. The older we get, I guess people start to think about whether or not surgery is a way to go, or perhaps less invasive procedures, fillers and Botox and all that kind of stuff. And you are going to remove some of the mystique around that. Now, you were mentioning as we were in the break that, well, I know you travel a lot. What do you say, 40 weekends a year?
Yeah, I do these teaching workshops for doctors throughout the U.S. and the world about 40 times a year. And
you are really using social media to help you along with that. So you're doing some, will you explain it?
Well, there seems to be an endless fascination, not a preoccupation. I would say it's a fascination and interest, whether someone ever does it or not. They love to see transformation, transformative stories. And aesthetic plastic surgery is about transformation. And so, it really started in the 10, 15 years ago, Extreme Makeover, The Swan, Nip Tuck, shows about kind of ridiculous and a bit on the edge.
Weight loss.
Yes, the weight loss, the American Loser, The Biggest Loser.
Yeah.
And the new show Botched and,
right.
90210. So people, I think they have a fascination, whether they ever do or not. They love to see people transform. And it seems to be an elemental human condition, whether you transform psychologically or physically or emotionally. And so there's some really cool feeds, like this one called Periscope, which is a Twitter live streaming feed, sort of like Spotify, but for video. And so anyone in the world can sign up through Twitter to come to one of these workshops and just watch the injectable or the surgery or the mini facelift or the small liposuction demonstration. It's not for the faint of heart. So
okay.
If you didn't like Dexter season 1, I probably wouldn't watch this. But
who's holding the camera? Don't tell me it's you.
No, I have a workshop assistant who's well trained in the art of the iPhone 6 Plus.
Okay. Yeah. So you can actually watch an entire surgery. And how do people know if they follow you on that? Can they, on Periscope, they would follow you on Periscope?
It's actually interactive. So during the procedure, they can ask questions.
Really?
I'll answer the question while doing the procedure.
Will they know in advance what procedure you're going to be doing?
No, it's at this point, it's a fairly new app for Twitter.
Okay.
It's only 30 days old, so it's really cutting edge.
Oh, wow.
And, so there's not a lot of this preparatory. It's really just like live. It's like a live interactive medium for watching. Now, I pre-plan everything, so it's always fairly, it's going to be family friendly, and it's going to be educational, and I always talk my way through the procedure. So most of my viewers are actually non-doctors, but I set it up to, I have about 6,000, 7,000 doctors internationally that have come to workshops, and it's really set up for them. But the consumer also chimes in with comments that sometimes they're a bit sketchy, but
really.
So I think the whole world is moving towards this social interaction and engaging and education, and it's just another way that you can take a Twitter, what used to be a 40-character medium, and turn it into a live streaming video of opportunity.
So people would follow you on Twitter to have access to that?
Yeah, so they'll go to SpaMedica Canada Twitter, and then they can sign up through there, or just go on to periscope.com.
Okay.
And just look for various opportunities.
Very interesting. 416-872-1010, Star Talk, star 8255. Text us at 71010. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at SpaMedica. And we had a story we were talking about last week. I'm not sure if you heard about it, but this mother who went on the doctors, she was debating putting her 6-year-old under the knife to get her ears pinned back. It was a surgery that the mother herself had when she was 8 years old. She said her daughter hadn't been bothered or made fun of yet, but she felt like bullying was on the way. And I wanted to ask you, is that a procedure that you would perform on a child? Does it depend on the situation?
It's a very gray area as parents, and as a parent myself, and as listeners. you really want to teach your kids the value of strength of personality and commitment and caring and their heart. But you also know we live in a hideously vain culture where the book is judged by the cover. And so some things are clearly black and white. If your child has a cleft lip palate or a burn or some congenital hereditary abnormality, that's clearly going to isolate them and they'll be ridiculed. Most provincial Canadian plans would cover that. When you look at an outstanding ear or a Dumbo ear, it comes by many names, provincial plans do actually cover that up until the age of 15. And so, but it would be less of an indication to perhaps prompt an intervention, a painful surgery that a child doesn't really understand what's going on. And you're doing this preemptively because you know that bullying starts at age 6 and is intense right through adolescence. And so I think we should teach our children as much as possible to be strong of character, strong of mind, and that appearances are sublimated to intellect. But we should also temper it with reality that if you have certain conditions, most of them hereditary or traumatic, that are outside the norm, you're really submitting your child to torture because bullying is rampant.
Oh, and it affects kids for their entire life.
It does. But having children or adolescents preoccupied with the Kardashians and the size of their buttock and breast proportion and noses. And I think that is also sending a very wrong message to our children.
But yeah, and I think those are two very different things. We'll talk more about that. I just want to get this call in before we have to take a break. 416-872-1010. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at SpaMedica. David, go ahead. Welcome to the show.
Hi. I'm just wondering, what's the best filler for those deep creases that go down the sides of your mouth? And what are the longest lasting fillers for that sort of procedure?
David, that's an excellent question and one that's often asked. And so, the face is a transient structure. It's always changing. And so permanency is a dangerous word when it comes to fillers because we can put things like synthetic silicones and different polymers in the face, but your face deflates and sags. And what looked good at one age and did a good job plumping suddenly is descended and your smile lines becomes your jowl and your jowl becomes your chin. And then so it's a slippery slope and Isaac Newton always wins. And so I'm a big big fan of long-term fillers, and long-term for facial aging is usually in the range of 1 to 2 years. So some of the newer products like Juvederm Voluma is a wonderful safe sugar gel, very little allergic reaction potential. It lasts about 1 year to 2 years. And after 2 years, almost everybody's face has changed, and what looked good then now needs to be adjusted now. And so I've really gone away from long-term fillers because the face does change. So fat, Juvederm Voluma, and some of these long-term safe HA gels are probably the direction you want to explore. Or just celebrate your smile line as a talkative guy.
What about taking your own fat cells and injecting them into the creases? I've heard of this.
So I love fat grafting. It's called fat grafting. It's very, very popular now. And what a great concept. Let's steal from where we've been saving it for a rainy day.
Oh, yeah.
And put these fat cells where we want them. So for women, it's often buttock augmentation called the Brazilian butt lift, or sort of a J-Lo. J-Lo is better than a way-low. And so you take the fat where you don't want it, you put it where you need it. Or breast augmentation. It's called natural breast augmentation, where you augment the size of the breast with fat rather than an implant. And then facial fat grafting. And so I'm a big fan of fat grafting. But the problem with that, David, is you have to go to the actual procedure room and harvest the fat so you have a donor site that has a little bit of pain, bruising, and discomfort. We then spin it down, add some stem cell magic to it, and inject it. But fat grafting is a very cool way to add volume, but you have more downtime, more swelling, and a donor site. But for many people, it is the way to go.
And is it permanent?
Fat is never permanent. As you gain weight and lose weight, some of these fat grafts can be responsive. I remember very vividly a young woman in the late 90s had put fat in her cheeks. She looked awesome. And she had a relational breakup. She turned to emotional eating. And damn if her cheeks didn't end up like 3 times the size that they were. Yeah.
Oh, no.
I said, oh, man, you got to get your eating under control because your cheeks are out of control. And they came from a fat resistant location where we store fat. So you got to be careful with fat grafting too.
That's interesting. Thanks for the call, David.
Thank you.
All right, we're going to continue. I've got some more questions about fillers and lots more.
The Night Side continues with Barb DiGiulio on Newstalk 1010.
Welcome back to the show. Dr. Stephen Mulholland is back, cosmetic plastic surgeon at SpaMedica. He's one of Canada's leading cosmetic plastic surgeons, and he is here to take your calls if you have questions about any kind of procedure, risks, costs. He is here until 9 o'clock, 416-872-1010, Star Talk, star 8255. Text us at 71010. Right before we went to the break, we were talking about fillers. And I wanted you to explain, as you did a little bit to me in the break, how you fillers, artificial fillers, I guess I'll say, versus your own fat. And when you are taking fat from a person's own body, is that taking fat like you're doing a liposuction procedure and they're seeing less fat there and more fat somewhere else? How does that work?
That's a good question. So there's small zone fat grafting, like our previous caller Dave. Smile lines. You only need a couple of syringes of fat. So fat harvesting one's fat cells to transpose somewhere else, can be a very simple little procedure under local anesthesia. A tiny little hypodermic needle, and you take the fat cells without doing liposuction, and that's most common for facial fat grafting, where we don't need more than 20 or 30 cc's of fat. When you're looking at things like breast augmentation with fat grafting, or buttock augmentation, or reconstruction of liposuction gone badly with indentations and divots, then you often have to do a minor to moderate liposuction of an area where you have a little bit more than you want, so you can purify, prepare, and inject where you need it. And so in those circumstances, yes, there's a little more downtime and recovery because you're doing a very large harvest. And rather than throwing away the fat, as would be done traditionally with biological disposal, it would be prepared and then injected into the region you want it.
So I would assume some people would just opt to do kind of a 2-for-1 idea. Might as well get the lipo done there and then fill this area, and you've got two things you're happy about at the end.
It is very, very popular right now with the popularity of the Brazilian butt lift and the Kardashians and full buttocks and breast augmentation done without implants. Fat transplantation has had a renaissance, as it were, and it's very much an alchemy, where you're mixing the fat with platelet-rich plasma from the patient and spinning it down, putting it into some sterile syringes and injecting it. So there's a little bit of wizardry, like, Canada's top fat chefs just redistributing the products. And so, and there is very much an art to it as well.
I would think.
You're right. You divide this into the artificial fillers, of which Juvederm, Restylane, Perlane are strong and well-known brands. And then the fillers that come from your own body, and fat is the number one. And then also taking blood and a blood element called plasma and injecting that plasma under your skin. It's got stem cells that stimulate old collagen cells to be new collagen cells. And so stem cell therapy is also a very popular procedure.
You're a bit of a scientist as well, right? When it comes to this stuff, you have to be.
You have to know the cell lines that you're extracting. Of course, you go through a long training process in plastic surgery. It's 13 years before you're licensed, minted, and thrust out into the community. So you learn the skills of the trade as a really an artisan or a cobbler of flesh, and then you have to understand the science of the cells you're dealing with. So it's kind of an interesting mix of art and science.
So if somebody is thinking about having that done, they want to make sure that their surgeon really knows what he or she is doing. So what is the accreditation for that? What do they need to have if you're looking to have that done?
That is really the crux of the dilemma of finding the right physician for your procedure. You can get certified, and what that certification means by the Royal College of Physicians and Surgeons, you've gone through the training to give you the skill set to go out into the community and be a plastic surgeon. But then, of course, it may take 10 or 15 years to become very skilled in subcomponents of that: facelifts, rhinoplasties, fat grafting, liposuction. And so in general, you want to find probably a plastic surgeon that's been in business for a while, has a good reputation. You would investigate the College of Physicians and Surgeons for loss of licensure or complaints. You would investigate perhaps the Canadian Malpractice Association for outstanding lawsuits. You would go online to Real Self or RateMD or City Search and Yelp and look what the social world is saying about your physician to be, and then have 2 or 3 consults. You have to have a good connection with the doctor, and then always ask for before and afters and be able to speak to patients they've treated. So it's rather an exhaustive process, but you're changing your body irreversibly. You want to get the best physician you can. And even in the best of hands, there's complications. So sometimes the mark of a really good plastic surgeon is the ability to salvage, a minor complication and get a patient happy who's moderately unhappy because the surgery didn't go as planned.
Dr. Stephen Mulholland is my guest, one of Canada's leading cosmetic plastic surgeons. You are always teaching people how to do things. How do you continue to learn?
I go to a lot of meetings. I meet some of the top doctors worldwide in Eastern Europe, and last year I've been to Russia, I've been to Berlin, I've been to all over Asia. And although I might be teaching, I always take the time to talk, to visit other surgeons. Through the small network of plastic surgeons, there's maybe 25,000 worldwide and 5,000 that are really top guys. I take the time to visit guys who are doing really interesting stuff, things that might be in less regulated environments like Canada, and see what's coming, what's new. And from those experiences, I brought some really cool stuff to Canada: ultrasonic liposuction, follicular unit, single hair harvest and transplantation, things that intense pulse light, different lasers that were just not available in Canada until someone in a less regulated environment was working on these devices. So I try to keep my eyes and ears open, look for very bright minds, and extract part of their cortex.
Have you ever been stumped by maybe somebody wanting something or needing something corrected?
I'd answer that in 2 ways. I did head and neck cancer for about 7-8 years, and I was in a position where I was removing a lot of areas that were affected by cancer, and sometimes you run out of tissue, and you didn't have options for optimal reconstruction, so it left deformities that were challenging and frustrating as a surgeon. In aesthetic plastic surgery, where you're not the victim of a cancer cell, you can actually plan things beforehand. It's less common to get stumped. But occasionally, sure, you're stumped by patients' expectations that can't be achieved. You're stumped by patients' unrealistic expectations that somehow this transformative surgery is going to change a bad marriage or get them off antidepressants. And so usually it's patient management issues, not the actual physical process of the procedure, that becomes the most difficult part of the job.
Very interesting. We're going to continue on with Dr. Stephen Mulholland. 416-872-1010, Star Talk, star 8255. You can text us at 71010. Any questions you have about cosmetic surgery, we've got a bunch coming in on the text board. We will get to those. Welcome back to the show. Dr. Stephen Mulholland is here. He is one of Canada's leading cosmetic plastic surgeons. His shop is SpaMedica here in Toronto. We're talking about all different kinds of procedures and trends. And I wanted to go to the text board for a couple of questions for Dr. Mulholland. 71010, is there any coverage for reconstruction, or not sure what to call it, for someone who needs skin tightened? I have lost 100 pounds, 55-year-old female. I have lots of extra skin.
The answer is yes and no. If you've lost a massive amount of weight, particularly in the abdomen or any area where you get inflammatory changes under that skin, so skin is lax, it sags on other skin, you get inflammation of the skin. And if you have skin infections and inflammation, then sometimes OHIP will cover it or other provincial plans. But you have to see a plastic surgeon, get some photos, they submit it to OHIP and see if it will be required. It would be covered.
Is that like when you have a flap hanging over and the skin underneath
Correct.
gets irritated?
Yeah, you get dermatitis, in essence, a contact dermatitis and irritation, and that will be covered. You won't get the other components of the lift, which is tightening of the muscles and contouring the fat, but you can get the skin removed if you do suffer from what's called a pannus, or a hanging portion of skin, and you get inflammation under it.
I was talking to you in the break about that show, is it My 600-Pound Life? Wow. I mean, it's incredible, the hanging skin that some people can end up with. It's almost like another person of skin, that much is hanging.
It's a very sad process for sure to have that kind of morbid obesity. And then the transformation from whatever either diet or gastric manipulation or lap band or various techniques that can be done to lose the weight. And then when you've lost the weight, you should be feeling great. However, you're undermined by all this excess flesh that is a grim reminder of the size you used to be. And so I see a fair number of individuals who do have massive weight loss, 100, 200, 300 pounds. And generally, we just do serial reconstructions of excess skin, the neck, the arms, the inner thighs, the tummy, and just try to get things taut and tight and more acceptable.
So now, aside from people who have lost a lot of weight, I've been reading about thigh lifts. This is for just sort of average sized people who are getting older and would like their legs to look a little bit better. Do you do that?
Yeah, thigh lifts are relatively common. The most popular thigh lift would be the inner thigh. So the inner thigh gets a little lax, you lose some weight, and it can have loose skin, sort of that Shar-Pei look. And so the granny thighs are generally are disconcerting. And so there's a small incision in the groin crease, and you often combine it with heating techniques to get the skin a little tighter, and then a little skin pinch removal with a fairly acceptable small scar. Those are the most common thigh lifts, what I call the mini thigh lifts, or the anterior or front thigh lifts. The stem to stern thigh lifts you see on some of those transformative shows with massive weight loss, those are a much bigger deal to recover from. The little mini inner thigh lifts are very popular.
Someone else is asking, what is the price range of liposuction for love handles?
So the most common areas that guys get lipo, and usually it's guys, and it can be sometimes women, would be guy lipo would be number one with the love handles. Number two would be that 50-year-old sort of male boobie, the gynecomastia, and then a double chin. And so guy love handles tend to be an isolated area. Often a guy will present with a huge stomach, and you think, oh my goodness, that's a lot of fat. This huge boiler, but it's hard as rock because it's intra-abdominal fat. It's the danger fat, the heart attack fat. And that's fat that needs to be lost. It's bathing the internal organs. It can't be lipoed. The love handles on the side, they can be removed with liposuction. In general, the price in Toronto, depending on how big you are and how much fat there is, would range anywhere from $3,000 to $7,000. It would be done under local anesthesia. 2 hours or less the love handle can go. With women, it's often in connection with that pot, that little annoying chunk of fat that lives in around your belly button, tends to sort of muffin top over a tight, low-riding jean, or over a C-section scar or previous surgery. And it's in connection on the sides with a love handle. So often with a woman, you're doing a lipo on a pot and on the love handle. And lipo's changed dramatically now. Most is done under local. Usually the first 5 or 10 minutes, we're liquefying the fat with gentle techniques using lasers and radiofrequency devices like Smart Lipo and Body Tight. And the aspiration or removing part is usually the last component of it. It's much less traumatic than it used to be. It's like taking your pot, putting it in the microwave, hitting go, and instead of a block of butter, you've got liquefied butter, and it comes out much easier. You get good contraction. So lipo's become a very elegant art of removing fat without large excision and with skin tightening, up to 30% skin tightening without removing skin. So it's really enabled patients to improve those stubborn, diet-resistant, exercise-resistant swellings and bumps that we have affectionate terms for, like the pot and the saddlebag and the bat wing and the dewlap and the
dewlap.
That's the double chin. You know.
Okay.
And so
I had not heard that one.
We have a lexicon of convex distensions, and usually it's just a cupful of fat that you want removed, and love handles right at the top of the list.
And does the skin actually shrink back?
And so that's what I was trying to get at, is that back in the day when I learned in the 80s, you take the fat, do nothing to the skin would look shocked for about a moment, and then it would sag. And you'd have those, this caricature type liposuction patients where you'd see a bunch of loose skin. It was just not attractive. So liposuction in the 80s and 90s was really for young people with a good skin tone who had excess fat in localized areas. It's not about weight loss. It's just about shaping. And then along came these cool techniques where we can heat internally while we're doing the lipo with Smart Lipo, Body Tight, Vaser Lipo, techniques that allow us to stimulate internal contraction, almost like thermage internally. and get internal contractions. So we can often get skin contractions of 25 or 30% just before you remove the fat that salvages a great contour, even if you're 55, 60, 65 years old.
Wow.
It used to be no for liposuction. It's now very much a possibility.
Dr. Stephen Mulholland is my guest, cosmetic plastic surgeon at SpaMedica. If you have a question, 416-872-1010, Star Talk, star 8255. You can text us at 71010. And cosmetic surgery on teens, we were talking about the whole Kardashian thing. There's one of the daughters she looks like a different person now with the big lips and all this kind of stuff. Teens who are getting that kind of stuff done, those procedures done, can it have a long-term effect? Can it make their skin sag earlier than it normally would have?
Well, I think that there's two answers to that question. I think fundamentally and professionally, it's unethical to take a teen that's having trouble just finding themselves in a world of uncertainty and then mixing cosmetic surgery into the mix. I just think it's not the right approach to raising children, number one. Number two, if you do a lot of excessive skin distension procedures, a large breast augment when you're 16, 17 years old, or you're filling your lips with products that distend and swell, you can cause changes to that skin that are irrevocable. Growth stretch marks get worsened if you put a lot of volume into breasts. And teenage surgery is just really, unless it's for, I think, reconstruction or deformity, and there's a gray zone sometimes where deformity ends and aesthetics begin. I just think it's a wrong direction to take our children, and the messaging that we get sometimes, I love Hollywood, is just, it may be, we view it as comical, but very much as the father of 6 kids, the teens take it to heart. It becomes very much a badge of honor or a rite of passage or unfortunately, a way to feel they belong. And I think that's just the wrong message.
I think she just had her breasts done. I think I've seen these pictures lately and all, when the tabloids start to speculate, but all of a sudden now with the lips and then the boobs and I'm thinking, this girl, this is crazy at that age.
It is a bit crazy at that age. And, never underestimate the wonder of a push-up underwire with padding.
True.
But I think given that the environment that they live in and the star status of transformative surgeries that family has certainly promoted, breast augmentation would certainly be behind the list of suspects for her recent figure and shape changes.
How often do you have to gently discourage somebody or try to talk them out of an extreme procedure or continuing to have things done when they've sort of done enough?
I think a experienced and busy plastic surgeon will often say no 70% of the time.
Really?
The numbers are quite, 15% of all plastic surgery patients have a true body dysmorphic syndrome, meaning that they cannot ever visualize themselves as attractive, and they serially seek out surgeries to fulfill a psychological and psychiatric problem. And so that's 15% have a true psychiatric disorder. And then you've got a whole host of patients that are doing it for the wrong reason. They're trying to gain secondary opportunity through looking better. They think perhaps I'll get a better job if I look better, or my husband will pay more attention, or I'll feel better myself. I'll get off antidepressants. You have individuals that are doing it for reasons that are suspicious. And are serially seeking surgery to achieve economic gain, and that may be unto itself a professional decision. An actress versus an exotic dancer versus somebody who's just doing it for social media optimization. The world has become crazy and very visual, and plastic surgery can, if the physician, fortunately we have many, many good ones in Ontario, if they're not looking out for the patient's best interest, there's often unnecessary surgery on patients that are not emotionally or psychologically in a position to make the right decision.
So I'm guessing that you always ask why they want to have something done?
Absolutely. It's I think good plastic surgeons are the best 1-hour psychiatrists out there to try and analyze and diagnose. And look, you're a pretty and you're attractive woman. Why are you doing this? And what is the motivation? How is it going to impact upon your life? And what supports do you have? And do you have a family? And do you have a job? And you look for orphaned individuals that are looking for plastic surgery as a last hope and a last opportunity. And it really is not the right patient at the right time. Many times you just need to step back, recovery from the death in the family, the bereavement or the divorce, and just recover some psychological perspective. And I've seen many women that come back and say, I'm so glad you said no. It was just the wrong time for me. And I'm just now focusing on other things that actually matter more.
416-872-1010. We are with Dr. Stephen Mulholland. If you would like to ask him a question, one of Canada's leading cosmetic plastic surgeons, or you probably are Canada's leading cosmetic plastic surgeon, are you?
Oh, there are many, many better surgeons than I am.
I don't know about that. We will be back. Welcome back to the show. We are in our final few minutes with Dr. Stephen Mulholland, cosmetic plastic surgeon at SpaMedica, and your questions at 416-872-1010. Star Talk, star 8255. Text us at 71010. We have more text questions. Do you pay physically for cosmetic fillers eventually? As a 55-year-old woman, I've considered Juvederm, but I fear once I stop the treatment, example, after 5 years, my skin will be more stretched or saggy than if I had done nothing in the same time period.
That's a very good question and a common misconception, one of those urban myths that are propagated online. If you do judicious amounts of fillers, just replacing some of the volume that's lost, you won't stretch the skin inordinately. And when it goes away, you'll just look like what you would have looked. And in fact, sometimes better. There's good studies show now that Restylane and Juvederm particularly will get collagen formation around them as a stimulant. And you may end up with a more supple and replete soft tissue envelope, i.e. your skin, with more collagen. But I think at a certain age, you can't just plump up deflation. Age of the face is really, it's the 3 Ds of growing old: deflation, descent, and deterioration. And often 3D therapy is important: a little Botox, a little filler, a little latent laser, a little tightening. So don't rely too much on filler. You end up like one of those filler faces, those dreaded caricatures like a James Cameron avatar descending upon people.
We've all seen them.
Yeah, the praying mantises. So filler needs to be judiciously used and balanced with other things like lasers and energy devices and Botox, and even eventually judicious little skin removals to keep things looking natural.
Now, a better question for her might be, if she starts now, in 5 years, is she going to want to stop?
It's very addictive. This is like the heroin of beauty, no question about it. It's like the crack cocaine of appearance. And it really appeals to the hypothalamus. And, there's lots of studies show that if you have a sense of well-being, your serotonin spikes. And serotonin is that one chemical that we crave, because it's our sense of, well, the world's falling apart, the economy's terrible, I don't have a job, my husband's a jerk. But I look good. And then when that happens, who cares?
That's true. If your hair looks good and your face looks good, you can conquer the world. Yeah. So what I wanted to ask you next is about something we discussed in the break: cosmetic tourism. A lot of people are, I've actually known, I've heard of people, not known them personally, going to Mexico, going to Costa Rica, getting very inexpensive plastic surgery done. It just seems so risky to me.
Well, I understand the motivation. You really want to transform a part of your body, and you've done your research. You know the procedure you want. You do some type of Skype or FaceTime consultation, and you go off and save half of what you would have spent in Canada, the United States. The corollary of that is the risk. What you're not certain of is the quality of the facility, the sterile techniques of the instruments being used. What happens if you get a metabolic complication like a heart attack or angina?
Oh, yeah.
What if you get a flesh-eating disease and you put your life at risk? So in my opinion, without sounding too self-serving, there are some very, very good plastic surgeons in Canada. We're all highly regulated by the College of Physicians and Surgeons. It may be $2,000 or $3,000 or $4,000 more expensive here, but what is the price on your safety and your life? And if you have a complication, your surgeon is there for you. They're going to be behind you to salvage that complication. So I can't see any place where having surgery outside Ontario, if you're an Ontario resident, makes any sense. Even going to another province is fraught with concerns and hassles. So I think cosmetic surgery, although popular, is something you need to very, very seriously question.
You know, honestly, I think there are some things that you should never cheap out on. I think you need a good mattress to sleep on. I think shoes, you should always buy good shoes so they're comfortable. And I mean, your appearance, why would you take a chance to save even a couple $1,000s? Then you can't afford to have it done, I think.
I think looking your best is important, but don't compromise your safety. And a good mistress is very important, as you mentioned as well.
How much younger can someone look without surgery, but with the use of fillers?
You know, it's quite amazing. If they go on, let's say, www.SpaMedica.com, shameless.
Please keep plugging it. Yeah.
The reason I'm saying that is that if they go on soft tissue fillers or something called Volume Lift, you'll see, I did a show on the Today Show about 7-8 years ago where I took a woman in her mid-50s and I took 9 syringes of Restylane and strategically injected all the deflated areas of her face, a few syringes of Botox and a light laser. And she literally looks 7 or 8 years younger and very natural. Also on the website is a doctor show segment I did live on the doctor show where I took 8 syringes of her product and a woman in her early 60s, and she literally looked 47, 48 after. So
wow.
As a surgeon, believe me, I love scalpels. I love facelifts. I love what we can do with liposuction cannulas, but we got such cool things now that I tell all patients when they come for a consultation, do you want to do non-surgical treatments or surgical? Because whether it's face or body transformations, we have never been able to do more than we can now to turn back the clock with very little risk, with no surgery, with very little downtime. So I would encourage patients, if they're a little afraid of the surgical transformations, there's some amazing things that plastic surgeons and dermatologists can do without a scalpel.
And what is the downtime if someone is just getting those injectable fillers into their face?
So if it's fillers, Botox, a little photofacial or light-based treatments for brown discoloration and wrinkles, I would tell them that I do these on Fridays because I give them the weekend off. The vast majority of patients can be back to their life on Monday with a strategic excuse. So I tell all patients, we're going to do a little Botox, a little Juvederm, a little laser. You're going to look amazing by Wednesday, but go to work on Monday and blame it all on your dentist. Pull out the old dental card. I had a wisdom tooth extraction. Now, of course, their friends are not stupid. You know, after 8 or 9 years, they've had more than 9 wisdom teeth that have erupted. So I pull out the dental card or gingival surgery. I had my gums operated. No one says, "Ooh, let me look at your gums." So
is it ever frustrating to work in a field where nobody wants to admit that they've had your work done?
It is funny. I'll be out socially at an event, and they'll be. We're bounded by very tight, as we should, federal privacy law. So I never talk to patients ever. So I might be in a room or an event or at a Leafs game or at some restaurant, and I'll see 6 or 7 patients, and I just eat. And sometimes patients will come in and say, "I saw you at this restaurant. You didn't say hi." I said, "Well, you know, if I said hi, everyone assumed you'd had a cosmetic procedure,
right.
And that would violate your federally and protected privacy, right? So, you know, if you want to say hi, come and say hi to me. Then I'm happy to say hi, absolutely. And you know, it does cut back on referrals because a lot of patients will do a procedure, and their friends say, "Oh, you're looking amazing. What are you doing?" "Oh, I changed my skincare. I'm using Irish Spring now for soap." And of course, they've had like 13 procedures and look amazing, but they don't tell their friends.
They won't tell them it's you.
Right.
I actually had a funny thing happen. Probably 2 months ago, I ran into our mayor, John Tory, here at the radio station, and he said he had some skin thing that he had to get looked at, and he ended up coming into the building that you're in. And he said, of course, people saw him coming out and assumed he had cosmetic surgery done. And he said, "I haven't. They're just because you have skincare in your clinic as well."
Mm-hmm.
Yeah. So he, wanted to say that it wasn't actually that he had cosmetic surgery because he said people assume he does. He's a very youthful looking man.
Well, we talked about property tax breaks for those that do Botox. So.
And someone wants to know via text, what's involved in changing the hairline?
One of the most common things I do is hair transplantation, and it's changed dramatically. Gone are the days of the Bosley area where you have to get a strip graft and a scar at the back of your head, and you have, Jeremy Priven coming out of the ocean in Hawaii, and there's his strip graft scar. So now we actually have to have tiny little robots that harvest the hairs one at a time from the back, and we insert them individually in the front, so you actually have no scar at all, and it's very, very natural. So we harvest from the back of the hair, that sort of George Costanza, Friar Tuck privilege zone where you're never going to lose hair, and we move it to the front. The secret is to do it before you're George Costanza,
right,
so you can hide it. And it's never been more natural, never looked more amazing. So look up on the internet things like NeoGraft or Artis. These are the automated and robotic systems that don't use a scalpel anymore. There's no stitches, there's no staples, that harvest hairs one at a time and put them on your scalp. And we can even take hair from your back or your chest and put it up on the scalp. Not that it looks great, but we're able to actually transpose from body areas when you run out of scalp hair.
How many sessions is involved usually?
Well, it depends on the zone. So divide your scalp, the male orb, into the front third, middle third, and back third, the crown, the middle, and the front. And if it's just a front restoration like temporal parking lots, that will take 4 or 5 hours, and every 5 years you might lose some more hair and come back. So it's a serial chronic replacement of lost hair so you never look bald. And women are about 20% of my clients. And it's not much talked about, but think of your friends, women out there, your audience. Some women have a horrible diffuse thinning process that happens. And it's very embarrassing as a woman to see your scalp. And to add a little bit of density is some of the happiest patients I have never had surgery. They're women that had hair restoration and densification.
Very interesting. The website is SpaMedica.com. Hopefully you'll come back and see us again soon.
Love to, as always.
Thank you so much. Dr. Stephen Mulholland, cosmetic plastic surgeon. The place is SpaMedica, SpaMedica.com.
You've been listening to a segment from the Best of the Night Side with Barb DiGiulio podcast. Log on, listen, and download the latest podcast right now by visiting Newstalk1010.com.